And now it's a pleasure for Dr. Neill Harris, if you would give your testimony at this time.
Good morning. I'd like to thank Chairman Naylor, Subcommittee Chair Sheila Jackson-Lee, Ranking Chair Andy Biggs, and Subcommittee Vice Chair Corey Bush, and all members of the committee for this opportunity to testify for this hearing today. My name is Katharine Neill Harris, and I am the Alfred C. Glassell III Fellow in Drug Policy at Rice University's Baker Institute for Public Policy. I want to start by clarifying that the war on drugs is first and foremost a war on people. 450,000 people are incarcerated for nonviolent drug offenses on any given day. Black people are overrepresented in every aspect of the drug war, despite using and selling drugs at similar rates as white people. Since 2013, the presence of fentanyl in the illicit drug supply has intensified the overdose epidemic. But it is overly simplistic to assume that opioids alone explain the current crisis. Instead, this epidemic is a sign of a more persistent drug use problem, one that federal policy has not only failed to address, but has made worse through its harmful approach. But we are now at an inflection point. The tragedies of the overdose crisis have forced a reckoning with tough on drugs thinking, albeit one made possible only because the epidemic's early victims were mostly white. Still, any departure from the drug war mentality is a welcome development. Support is building for reforms that are centered on racial justice and harm reduction. But bad policies are hard to dismantle. Drug bans continue to play a central role, demonstrating a failure to learn from the drug war's mistakes and a misunderstanding of the roots of the current overdose epidemic. And while recent reforms have reduced mandatory minimums for some drug offenses, this problematic sentencing structure continues. I will now briefly discuss each of these policies. Given the overdose-related risks of fentanyl and its analogs, the urge to institute broad bans and harsh punishments is understandable, but it is also misguided. DEA argues that its emergency class-wide ban on all fentanyl-related substances is critical to aiding prosecution of people selling these drugs. But an analysis by the U.S. Sentencing Commission found no evidence that the ban was needed for these prosecutions. And more importantly, the class-wide ban doesn't work. Fentanyl-related overdoses continue to rise, even as those involving other opioids have leveled off or declined. Recent analysis also shows that law enforcement seizures of fentanyl are actually associated with an increase in overdose deaths. The ease of distribution of fentanyl and its analogs make any efforts to diminish supply an uphill battle. And in the unlikely event that federal authorities do make a significant dent in the fentanyl supply, markets will adapt by finding an equally or more lethal drug alternative. And we know this from experience. Government efforts to crack down on the supply of prescription opioids in the early 2000s led to the spikes in heroin and fentanyl deaths that we see today. So while it might seem like the right thing to do, a class-wide fentanyl ban is not benign. It makes illicit drug use more dangerous to the person using. This kind of ban also expands the reach of an agency whose mission is to make drug arrests regardless of the harms and ineffectiveness of this approach. DEA tactics widen the net of people who encounter the justice system and are arrested, convicted, sentenced, and continuously monitored by it. Like drug bans, mandatory minimum sentences have not reduced drug supply, demand, or death. They do not work. Supporters of these sentences claim that they target drug sellers, not drug users. But there's often no clear distinction between these groups, and many people who sell drugs have substance use disorders. Also, the amounts of drugs that trigger mandatory penalties are a poor indicator of a person's role in a drug selling operation. And to this point, most people charged with drug trafficking offenses are at the bottom of the distribution chain. Any vacancies created by these arrests are quickly filled and drugs remain available. Law enforcement has wide discretion to decide whom to pursue with mandatory minimums. This increases the likelihood that people who have substance use disorders or who are members of minority communities already subject to government surveillance will become targets for harmful interventions. Mandatory minimums impose long prison sentences and are disproportionately levied against people of color. But we don't need more data about how these policies are harmful and ineffective. We need action. And there are several immediate steps that Congress can take to promote less harmful, more effective policy. First, Congress should not extend the class-wide ban on fentanyl analogs. It should repeal mandatory minimum sentences. It should remove financial incentives for law enforcement to pursue drug offenses, and it should expand access to medication-assisted treatment and fund interventions that reduce the harms of drug use, not just for opioids. It should also remove cannabis from Schedule 1 and implement measures to alleviate the damages of prohibition, such as those included in the original MORE Act. My time is up, so I will end here, but I look forward to your questions, and thank you.
Thank you very much, Dr. Neill Harris, for your testimony, and now we yield to Mr. Maltz for 5 minutes. Thank you so very much. For Dr. Neill Harris, welcome again. 36 states, District of Columbia, and others have adopted laws allowing legal access to cannabis. 15 states have adopted laws legalizing cannabis for adult recreational use. Nonetheless, marijuana continues to be a key driver of mass incarceration. Why do you think it's important to remove cannabis from Schedule 1 of the controlled substances? Why is this action so important? How can Congress support these data-driven, effective programs like the Law Enforcement Assisted Diversion Program, and how do these programs successfully demonstrate an alternate pathway for treatment of individuals struggling with substance abuse? I've combined two questions, two aspects of the questions, and the time is short, but I'd appreciate if you'd be able to answer. Dr. Neill Harris?
Yes, thank you, Madam Chairwoman. It's very important for Congress to decriminalize marijuana for a few reasons. One is that it will send a message to other states that this is an important act. I believe that some states are waiting to see federal action before they go to decriminalize themselves. Second, we know that even though legalization is spreading across the country, racial disparities in arrests continue. Black people remain over 3 times as likely to be arrested for marijuana possession nationally, even though we have seen this large move for reform. And the MORE Act that has been brought up in this hearing is a perfect example of legislation that also targets the racial inequities that we have seen from the drug war by reinvesting in communities. Programs like law enforcement assisted diversion we see work because what they do is that they catch somebody before arrest and they put them in contact with treatment and with social services that can help with that problem. And they bypass the entire criminal justice system so that person does not become ensnared in that.
Thank you so very much. Appreciate your answer. I knew my time has expired. I now recognize the ranking member for his questions for 5 minutes, Mr. Biggs.
Dr. Neill Harris, please tell us more about your views on the class-wide ban.
Yes, thank you, Mr. Chairman. I would like to briefly respond to the point about the border and the drugs that are coming across the border and just remind everyone that the reason that we have so many drugs coming into this country is a direct result of prohibitionist policies. And the fact that 90% of drugs remain unseized goes to show the ineffectiveness and the fact that people are still getting access to these drugs.
Thank you.
Problem with the class.
Go ahead. Go ahead.
Oh, with respect to the class-wide ban, I was just going to reiterate that the bans themselves, when you ban a certain substance, people, chemists, traffickers, people selling, people using will find alternatives. That's how we got to the point where fentanyl is so prevalent in the heroin supply, because heroin was prohibited. So we had to people found a different way to get something smaller and more lethal to supply the demand that exists in this country. We have to focus on reducing the demand. As long as we focus on the supply, we will continue to see more deadly alternatives come to this country and continue to contribute to the overdose epidemic.
Thank you. In 2018, the New York Times reported that in New York City, Black people were arrested on low-level marijuana charges at 8 times the rate of white, non-Latino people over the past 3 years. In Manhattan alone, Black people were arrested at 15 times the rate of white people. As you know, I am the author of the MORE Act, a bill that would eliminate marijuana from the list of federally controlled substances. Could you describe, please, why this is the right policy and why it's necessary to help communities most adversely affected by the war on drugs?
The MORE Act is essential because what we have seen so far with decriminalization and legalization throughout the country is that the racial inequities continue. Even in states that have legalized, you continue to see racial disparities in arrest rates. The MORE Act is essential because not only does it decriminalize, which sends a strong message to states, but it also lays a blueprint for how to redress the harms of the drug war through actions such as barring discrimination for public benefits and social assistance and all of those important components. It bars discrimination against those for people who have been convicted of marijuana-related offenses. It also lays out a process for expungement for past convictions. And it also provides opportunities for people of color to get involved in the marijuana industry. What we have seen in states that have legalized is that that industry is dominated by white men. And so the communities most hurt, most impacted by the war on drugs have been unable to benefit from legalization. MORE Act is critical to be able to enforcing that and to seeing that progress.
Thank you, Ms. Austin.
If I could go quickly to Dr. Neill Harris. With the American Rescue Plan, Congress just passed the most significant child poverty reduction policy in a generation. I'm excited to have been a part of it. Your testimony mentions that the latest research shows children with parents caught up in the criminal justice and carceral cycle are at greater risk of negative outcomes in adolescence and childhood and adulthood. Can you speak to that a little more?
Yes, thank you for that question. When children have parents who become a standard of the criminal justice system and become incarcerated, that disrupts their home life. It creates uncertainty for them, and it disrupts every routine that they might have that might be able to provide stability for them. It can interfere with their schooling. It can interfere with their mental health. It can interfere with their physical health. It literally impacts every aspect of their life. If they have to go into the foster care system, then they have to deal with that system and the disruptions that it causes. I know here in Texas, we have a lot of problems with our foster care system that negatively impact a child's life as well. And so it's literally setting them up at the most precious part of their lives where their brains are still developing with all of these additional stressful factors to deal with that impede their development. And later down the line, then it becomes more difficult for them to excel with education and employment opportunities, which creates a cycle where then they can then themselves encounter issues with mental health.
Expired.
Dr. Harris, why is national drug policy reform essential for reducing the federal prison population and for providing states with a blueprint for effective policy change?
Thank you for your question and for your passion on this issue. Federal reform is essential for states to follow suit. We saw this, if you look back in the 1980s when the federal government ratcheted up penalties for crack and the disparities it created for crack and cocaine, we saw the states follow suit. And so we know that the states will do what we see the federal government do on these issues. So if the federal government takes leadership, we will see more responsible policy at the state level. We also know that punishment does not work. We've been talking a lot about mandatory minimums here. Mandatory minimums levy very severe sentences, but they do not deter people from using drugs. The very nature of addiction suggests that people are not going to they will use drugs regardless of what the consequences are. And so that approach will not work. We've been talking a lot about the demand for drugs and the cartels. Absolutely, cartels can be dangerous organizations and very profitable. That is because of the demand for drugs that we have in the United States. And we have not addressed that demand. We have 40 years to show that we have not addressed that demand. And it is time to try something else instead of continuing the same failed policies.
Thank you.
And Dr. Neill Harris, as we all know, America's opioid crisis is far from resolved. According to the American Medical Association, over 40 states have reported an increase in opioid overdose deaths since the beginning of the pandemic. And in my home state of Rhode Island, opioid overdose remains the leading cause of accidental death. Every day, we are at risk of losing more and more people to overdoses, with recent numbers showing that Black and Hispanic Rhode Islanders are disproportionately experiencing overdose-related deaths. Through various research trials, evidence has shown that medication-assisted treatment is an effective treatment for opioid addiction. And we have some great leadership in Rhode Island from the medical community that's been really leading this effort, particularly at Brown University. And so my question is, do you think that these programs should receive more federal support? Are there other programs that also should be available? But what are the most efficacious ways to provide the kind of treatment that will have a meaningful impact on this problem?
Absolutely. Thank you for that question. I like to think about this in terms of short-term and long-term solutions. And when we talk about reducing overdoses, we're talking about these short-term solutions to provide treatment and immediate interventions. Rhode Island has done a great job at increasing access for medication-assisted treatment, especially for people that are in the criminal justice system. I would like to see federal funding go to expanding the access to medication-assisted treatment within correctional systems in all states. And not just for Vivitrol, which tends to be preferred because it's an opioid antagonist, but also for methadone, and Suboxone, because people need the option that works best for them. The other thing that I think that the federal government can do, in addition to expanding access for needle exchange programs and authorizing safe consumption sites, is to expand access to drug testing services. Mr. Maltz had mentioned the problem of counterfeit pills. Absolutely, when people unknowingly take pills that they think are legitimate prescriptions and they contain fentanyl in them, that is very dangerous. If we provide people with resources so that they can test those substances and determine whether there's fentanyl in them, research shows that they will moderate their drug use behaviors and can use in a safer way. And so we need to focus on those harm reduction interventions.
Great. Thank you so much. And with that, Madam.
4, maybe 5 decades of this war. And I have a question for each one of our panelists here today. Are we winning the war on drugs? Ms. Austin Hollerith, yes or no?
We are not winning the war on drugs. The numbers show that the
Mr. Henderson, yes or no?
No, we're not.
Mr. Maltz,
No, we're not, I'm sorry. But we
Ms.
are making
Neill
a difference,
Harris,
saving lives.
yes or no? Thank you. Ms. Neill Harris, are we winning the war on drugs?
No, we are not.
Yes or no question to each one of our panelists. Do the incarceration of drug addicts, does that help them go straight? Yes or no? Just jail straight out drug addicts. Ms. Austin Hollerith.
no.
Mr. Henderson.
No.
Mr. Maltz.
Can't answer that question, it's too vague.
Putting a drug addict in jail, does that straighten him or her out?
If they have a drug addiction
Yes or
issue,
no?
jail is not the answer.
Thank you. Ms. Neill Harris.
No.
Thank you very much.
Ms. Neill Harris, I believe earlier you had stated that about 90% of the legal drugs are in fact not stopped or caught or interdicted. Is that correct?
Yes, and Mr. Maltz had said that about 10% are stopped or interdicted, which would mean that 90% are not.
So my view is if we keep doing the same thing over and over again and expect a different result, that does come close to the definition of insanity. And we've been at this war on drugs for many decades. It does not appear to have gotten better. It actually appears to have gotten worse. So it seems to me we should now look at other ways to try to reduce people using drugs, particularly if they're addicted. Because if they're addicted, it seems to me that it's a medical issue. What we actually would need is treatment. And so I'd like to ask about opioids. And Ms. Neill Harris, I'll ask you this. So it seems like part of the reason there's an opioid epidemic is because people would get prescription opioids because they got into a car injury or some other sort of surgery or something where they wanted to relieve pain. The doctor prescribed it. And then all of a sudden, 2 months later, they realize they're addicted to this. It's not like they went and sought out to get addicted. Does it make any sense to put those people into jail?
Thank you for that question. And no, it does not make sense to put those people in jail. And I'd like to briefly clarify the distinction between dependence and addiction. And it's an important one to make when we're talking about opioids. If I got surgery and had to take opioids for an extended amount of time, if I had to take them, say, for 10 days straight, my body would become physically dependent on those drugs. It would be difficult for me for a few days to stop using them. That is a different process than psychological addiction. What happens when people take these drugs, it doesn't only alleviate physical pain, it also helps them feel better about other things that are wrong in their lives. And we've talked a lot here about the root causes of addiction: poverty, inequality, mental health problems, mental illness, physical illness, all of these things. And so if we really want to address the roots of psychological addiction for opioids and for all drugs, we really have to invest in addressing those systemic issues that lead to addiction.
Thank you.
Let me ask the panel a question, and I don't know who the right responder may be. Let me start with Ms. Harris, because I liked your 5 minutes. I agreed with everything you said. I read that Mexico may be decriminalizing or legalizing recreational marijuana. Have you seen that story?
Yes, Congressman, I have.
Assuming they do, how's that going to affect the drug situation as far as Mexico, the cartels, the United States goes. I mean, if there's legal recreational marijuana in Mexico, does that take away from the cartel strength? What happens?
I think that legalization in Mexico will reduce the cannabis aspect of their business model. However, the cartels are essentially, like Fortune 500 companies. They are well-run business organizations. They have been able to capitalize on prohibition that we have in this country and have been able to profit immensely off of supplying the demand that we have here and have not addressed. And so they've made an immense profit off of that. I think that they can, they have diversified to other sources of revenue, such as human trafficking and the trafficking in other goods besides drugs and besides people. So I do think that the issue of the cartel is one that is a complicated issue to address, that I think that, legalizing cannabis here and in Mexico is one step to addressing. I think that if we decriminalize drugs and remove all of the profit that comes along with supplying the demand of drugs from the cartels, that will also help to put a dent in their businesses and in the violence that they perpetuate.
Exactly. Okay. Let me ask you this too: an arrest or conviction for even a minor drug offense in the United States can have lifelong consequences to the individual who's been arrested for convicted of that crime. They may not be able to get a job. They may not be able to obtain a loan, professional license. Maybe they can't get a college scholarship for housing, federal housing, etc. Tell me a little more about these collateral consequences and other solutions to address this unfair impact on our criminal justice system.
Thank you for that question. You really just explained a lot of those collateral consequences that people have. It really can damage their employment prospects, especially when we treat drug possession as a felony, which in my state of Texas we do. And the possession of any amount of drugs other than cannabis is a felony charge. That's on a person's record. It impedes their ability to get a job. It impedes their ability to get assistance with housing, with employment, with education. It can impede their parental rights. There has been legislation at the federal level to bar discrimination from federal loans for education for past drug convictions. I think that's excellent. I think that we need to work to provide for expungement for people's records, to make that process automatic so that people don't have to navigate through the bureaucracy of the legal system to have that happen. I also think that all of the reforms that we've been talking about here, about reducing mandatory minimums, about reducing drug disparities, all of those need to be retroactive so that people currently serving sentences for those things can be released for them as well.